name is Dr. Seong. I'm from Alpha IVF. Today I'm going to talk about thalassemia. Thalassemia is an inherited blood disorder which the body will make abnormal hemoglobin. Hemoglobin is a protein in the red blood cell that responsible for carrying oxygen to the body. Alright? People with thalassemia will have excessive destruction of the red blood cells, which in terms will cause complications like anemia and also other complications. In general, thalassemia is quite common, and in fact it's the most commonest inherited blood disorder in the world, and is very common in this part of the region. And 3 to 5% of the Malaysian populations are carrier. The most prevalent thalassemia in Malaysia are alpha and beta thalassemia. If one parent is the carrier of the thalassemia, then this can occur. So 50% chance of the child will be a carrier, and then the other 50% chance will be a normal. Alright, will be a normal child. So if only, let's say, one of the parents is thalassemia carrier, then none of the offspring will be a thalassemia major. Okay. I mean the other way around, if let's say both parents are carrier, then there's a 25% chance of the child being affected, meaning that it's being a thalassemia major. Another 25% will be completely normal, and another 50% will be thalassemia carrier. Thalassemia minor will have normal life expectancy. Okay, if a baby have alpha thalassemia major, it usually die at about 7 months into the pregnancy. A child with a beta thalassemia major usually have a shortened life expectancy. Keeping them alive requires a monthly blood transfusion. Okay, lifelong blood transfusion will lead to iron overload and also multiple organ failure. So the patient with thalassemia major, they need a frequent blood transfusion, normally 3 to 4 weeks, and also this special treatment called iron chelation therapy in order to maintain their normal activity. Thalassemia can pass down from one generation to another, so it's advisable for you to go for thalassemia screening if you are planning to start a family or you are getting married. Sometimes we do detect patient that is pregnant and come here for follow-up, and then through the blood screening we noted that is suggestive of thalassemia. Then we will ask them to screen their partner as well. If both confirm are thalassemia carrier, then they have to go through a more invasive procedure such as coronary villus sampling and or amniocentesis. Yes, currently the only cure is through bone marrow or stem cell transplant. Alright, bone marrow or stem cell transplant will depend on finding a HLA match donor. HLA stands for human leukocyte antigen. So in order to find a fully matched HLA donor is very difficult. I mean, the other way to do it is through IVF with a pre-implantation genetic testing and also HLA typing. Alright, meaning that let's say this couple have a 6 sibling with a thalassemia major, and then so they will go through an IVF process. The embryo created through the IVF process will be screened using a pre-implantation genetic testing and also try to match with the HLA antigen. Alright, so the embryo that created is chromosomally normal, free from thalassemia, and HLA matched with the 6 sibling. So once we have this embryo, we will transfer back to the womb. If she get pregnant and then subsequent delivered, then we will collect the cord blood and also the umbilical cord and cryopreserve it. So in case the sick sibling needs the stem cell, then we can use this stem cell to do the transplant. Alright, another thing is prevention is better than cure. So let's say both parents are thalassemia carrier, then they can have the option to go through IVF with pre-implantation genetic testing. Same thing, the embryo created through the IVF process will be screened through chromosome, 23 pairs of chromosome, and also we'll make sure they are free from thalassemia before we put it back into the womb. So the baby will be free from thalassemia. I hope this information will be useful for you. If you have any other query, please do not hesitate to get in touch or visit our website. Thank you.